Hi, today's video is about establishing a preventive action for 2021. A lot of companies will have corrective actions that they will have an element of that they will say is preventive. But what they really mean is this is preventing reoccurrence. And there's a lot of confusion caused by the difference between a true corrective action and a true preventive action. True corrective actions are going to be in response to complaints, adverse events, non-conforming material, and audit findings. If an auditor, whether it's an internal audit, first-party audit, a customer auditing you, second-party audit, or your MD/SAP auditor comes in and has a finding, that's a third-party audit. Whether it's first or second or third party, if an auditor found it, it's a corrective action, not a preventive action. So how can we have a true preventive action for 2021? And the example I'm going to give you applies to all the companies out there that have Canadian licensing. So if you have an MD/SAP certificate, if you have a Canadian license, this applies to you, and you should take credit for this preventive action. If you wait until your internal auditor finds, oh, we didn't do this, you wait until your customer comes and audits you and say, you didn't do this, or your MD/SAP auditor says, you didn't do this, now it's a corrective action instead of a preventive action. So you're going to do the same amount of work, if not more, if they find it. So give yourself a little bit of credit here. Do this proactively, follow my instructions. And if you don't have Canadian licensing, you can still use the exact same approach to any regulatory requirement change. So remember back in 2019 when 14971 updated, that was an opportunity for you to create a preventive action. Did you? Probably not. You probably waited till an auditor pointed out, oh, you didn't do this. So be proactive. That's what preventive actions are all about, being proactive. Identify it before an auditor identifies you didn't do this and you were supposed to for compliance. If you catch it before the auditor, now it's a preventive action. So here's how we do this. There are 5 steps. Step 1, you have to review your regulations periodically to identify when the change is going to occur, when there's a change in the regulations. The place that should be documented is in your management review procedure. You should say, here are the applicable countries where we do business in, and this is when we're going to check the regulations in the US. This is when we're going to check regulations in Europe. This is when we're going to check regulations in Canada. This is when we're going to check regulations in China, Saudi Arabia. You get the idea. You might even have you might even segment it like, here's when we're going to check ASTM standards, ISO standards, CLIA standards, whatever the standards are, do it in groups. Save yourself some effort and just periodically say, every month or every other month or every quarter, I'm going to look at a segment of our regulations and I'm going to have it on a rotating schedule, because these regulations don't change overnight. It takes years to change the standards. It takes years to change the regulations. So if you're periodically reviewing them on an at least annual basis, you shouldn't run into a problem. Also, if an auditor does say, oh, you missed this, you can say, well, our procedure says I checked this in this frequency, so it should have been caught on this date. And either you didn't follow your procedure or the regulation changed faster than you anticipated, and that's why you missed it. And that would be a much easier root cause to address than I didn't do it, or I don't have a plan for this. So write in your management review when you're going to review various regulations and various standards, and stick to that schedule. And it's just a brief schedule. You can have it as appendix to your procedure. Oh, the schedule for reviewing regulations and standards will be in the back in Appendix A, for example. So at your management reviews, you're going to identify these are new regulations. And so you did your review, you identified the CMDR changed. So the CMDR is the Canadian Medical Device Regulations, also known as SOR 98282. It changes frequently, more than once a year. But When they make a major change, not a change to a word or a change to like a fixing a typo, but when they add a new regulation to the Canadian regulations, there's a transition period usually. They say this is when it's going to come into force. If you read the CMDR SOR 98282, you will see on page 66 that it says at the top of that document, amendments not in force. That means they're not in force yet. They will be in force in the future, but they're not in force yet. So you have time. It's still a preventive action. If you wait until they're in force, now it's a corrective action. So you want to do that proactively. I'm telling you now, I think the transition deadline for some of these items, like post-market surveillance changes, are December 23rd of 2021. So you have maybe a month to work on this, but that's doable. You can revise a procedure in a month. It can be a preventive action still. So step one, you have in your manager review procedure, this is when we're going to review regulations. Make sure you review the Canadian regulations right away because they already have changed, but the change hasn't been come into force yet. Just like the MDR took a long time to come into force, Canadian regulation change, it's not in force yet. Identify the new regulations. I'm telling you now, pages 66 through 75 of the CMDR, that's where it begins. The title at the top of the page is Amendments Not in Force Yet. That's the new stuff. Step 3, develop a draft quality plan and present it during your management review. You're required to review new and revised regulatory requirements. Prior to 2016, all you had to do was identify them. Now they've gotten more specific in the 2016 version of 1345. They say, and come up with a plan for how you're going to address the changes. So you need to present a draft quality plan at the manager review and have the management team either revise it or give a thumbs up. So let's say they give you a thumbs up. Now you can initiate a preventive action. That's an action item from your manager review. The management team blessed your plan. You initiate a preventive action. It formally goes on the books as a preventive action. That's your action item for your manager review. The next item is initiate the preventive action. So actually do all the action steps that are in your plan. So you have a quality plan. You edited it during the manager review. The management team said yes. You initiated a preventive action. Now do that. Do whatever the steps are. And it should be revising multiple procedures, revising your quality manual, training people on the changes that you just did. That's the implementation. That's it. That's all you got to do. Revise your quality manual, revise the procedures, train people on the changes. Done. Now the effectiveness check. We perform an internal audit of the individual processes that you changed for compliance with the CMDR. In order to conduct that audit, you need a qualified auditor. Now, does that mean you have to go find a consultant like Rob Packer to do that audit? No. You could have somebody on your team train on the changes in the CMDR that is already trained on the CMDR, but now they need to train on these new requirements. It can be self-training. How did Rob Packer get trained? Self-training. There isn't a course I can go take prior to everybody else being in compliance. I need to learn so I can go audit them. So I train myself. I read the regulation. I see what the changes are. If I have any questions about them, I'll contact experts such as maybe somebody at Health Canada or maybe somebody at a notified body that's doing MDSAP training. So I'll talk to an expert if I have questions, but I might not have any questions. It might be very straightforward with the changes, and that's how I document my training. So I say on this day, I reviewed it and I did self-training on this change to the new regulations, and I'll be specific. I had this training, this training, this training. Okay, now I am done with the self-training. Now I am qualified to audit that process because I already was a lead auditor. I was already trained on CAMDCAS. I was already trained on MDSAP. I was already an MDSAP auditor. So now I'm going to do this internal audit for a client to verify compliance. Do you have to hire an outside consultant to do that? No, you don't. Do they have to be an MDSAP auditor that works for a certification body? No. It can be in-house, but they need some training on the CMDR beforehand, and they need to self-train on these changes to the new regulations. So you perform your effectiveness check is an audit of the processes that change for compliance with the new standard. Okay, let's say the auditor finds a gap. So you went through all the quality plan, you created your preventive action, you implemented, everybody got training, and you found a gap when you did your effectiveness check. Now you have to open up a corrective action for that particular gap that you missed. Now, is it possible that it's not significant enough of a gap that you really need a corrective action or CAPA open? Sure. It might be a minor typo or omission, make that more clear. So, it could be written up as an opportunity for improvement by the auditor. I recommend clarifying the wording here or revising this wording of the sentence so it matches exactly what the regulation says. Or my experience says that the notified body wants this wording, so change the wording to say this directly out of the regulation rather than the wording that you chose. That's not worthy of a corrective action. But if you missed a whole entire section, maybe that is worthy of a corrective action. It's not just clarification, it's you missed something. So now it's a corrective action. But if you have a customer come in and do an audit for compliance with the CMDR and they find the problem, it should definitely be a corrective action unless they say it doesn't require one. And if it's a notified body or a certification body doing an MDSAP audit and they're doing it after December 23rd and they catch this gap, now you don't have a choice. They're going to write it up as a minor or major nonconformity, depending on how many times you've made this mistake before. And they're going to say, you need to open up a formal corrective action, and you have so many days to do it. If it's a minor, you probably have 30 days. If it's a major nonconformity, higher risk, has like a 3 or a 4 score on that MDSAP scoring of corrective actions or findings, now they're going to say you need to implement this in 15 days. And so it's usually a 2-week turnaround on those. So the idea is to be proactive, identify the changes to the regulations. That's step one. Or step one is revise your management review procedure so you can systematically conduct reviews of the regulations to identify them. That's step one. Step two is to actually identify the new regulation. Step three is develop a draft quality plan. Step four is to initiate a preventive action because top management agreed in the management review. And step five is the effectiveness check to make sure that the implementation of the preventive action was complete and effective. If you have gaps that are found in the first, second, or third party audits, now you have to follow up with a corrective action or at least a correction if it's something minor. So I think I explained all that well. That's for how you would do it for these changes that are occurring right now, and you have about a month to comply. So for those companies out there that are have your MDSAP certificate, this is helping you out for free. So follow our advice. It's 5 steps. Watch the video over and over again until you got it. Write up your plan. You can have a manager review that's an additional one that you weren't planning on. Like, oh, I found out about this change. We didn't cover it in our last manager review. Let's have a short manager review in early December so we get this on the books. Or you could say, well, we already had a manager review and we're not going to wait till the next manager review because that's too far off. We're going to open up the preventive action now. That's okay too. But step one, review your regulations systematically, put it in it's like an appendix to your management review procedure. Identify any new regulations, develop a quality plan, initiate the preventive action, and then perform an internal audit for effectiveness. Now, if your company doesn't do anything with Canada, you're not out of the woods. There are always changes occurring. So, for instance, if you have CE marking, you have the MDR took place. They didn't stop making changes. They have the medical device coordinating group, MDCG, that's constantly churning out new guidance documents. Every single one of those needs to be added to your procedures, and you need training on it, and you might have to add additional clarification to your procedures to comply with that guidance. You might need additional training. So that's an example of another type of change. If the FDA comes out with a new guidance document on, let's say, how to conduct post-market surveillance, or how to do adverse event reporting, or how to do recalls, or They come up with a new guidance document on how to conduct a certain type of testing, like let's say laser testing. Any of those things would be something that would be worthy of a quality plan. It would be worthy of a discussion in your manager review. It would be a potential preventive action. All the steps that I talked about, you can just change what the topic is. Instead of it being Canadian regulations, now it's some other regulation. Any standards that change, you might have to come up with a quality plan, but it might not be a quality plan for your quality system. It might be a quality plan for updating your technical file documentation for CE marking. You might have to do some revalidation. You might have to redesign your product to be now compliant with the state of the art. I'll give an example. It's not just Europe that does this stuff. The US does it too. I'll give an example. Blood pressure cuffs. They had a small bore connector warning information that was sent out by the FDA. They had a guidance document on small bore connectors. They had a standard that was created on small bore connectors, all because the FDA saw a trend of these serious adverse events where people would accidentally connect a blood pressure cuff to, instead of connecting the blood pressure cuff to the blood pressure monitoring device, instead they would connect their blood pressure monitoring device to an IV, and this would be an accident, a use error, and therefore to prevent this use error, they've changed the requirement. You must have only use the IV connections or Luer locks for IVs, and for every other type of small bore connector, use something other than a Luer lock. Come up with some other kind of connector to prevent this use error. That would be an example. They said everybody's going to have to redesign their product. Everybody's going to have to resubmit 510Ks for this design change. And if you don't, you have to pull your old product off the market. And you have to have a transition plan for this. These were things, this happened several years ago. You had to do this. So this is not something new that happens only in Europe. It happens all over the world for all kinds of countries. They'll identify a problem. They'll come up with a new guidance, a new standard, a new regulation, and you have so much time to comply. Or if it's an urgent thing, like people are dying because they connect things to the wrong connector, they might say, you don't have a transition period. You need to implement it right away and pull your product off the market that doesn't comply. I've seen that for all kinds of products, all kinds of medical devices all over the world. This is not something unique to one market. I just used CMDR in Canadian regulations as an example because it represents such a large segment, and we're talking about more than a dozen pages of changes here in a document that's only like 75 pages long. So this is really important that you should be implementing a preventive action. You have to have preventive actions anyway. Here's an example of being proactive, identifying a change to the regulations, and how to implement it step by step. I hope that was helpful to you. I hope you all see this before it becomes a corrective action. And if you have any questions, stay tuned to our channel. We're going to have more announcements about this. We'll have webinars about it. We're going to update our own procedures for compliance with this. And that's going to be the topic for December. And I'm mentioning this on November 19th. While we're still covering preventive action and corrective actions on CAPA, this is leading you into next month because let's face it, next week's Thanksgiving. And how many of you are actually going to watch my video on Friday, the 26th? Probably nobody. So I might even skip it. I'm not sure whether we're going to do one on the 26th or not. But anyway, we will do something next week. I may not do it on the 26th. I will put it on our website. So if you're interested in the live stuff, I'll do something next week. I'm just not sure I'm doing it on the 26th. But we will be having December coming very quickly here, just in 2 weeks. And we're going to get into this topic of the Canadian device regulation for the month of December. So that will be the topic in December. And I want to let you know now while we're still on the topic of preventive actions. I hope this helps everybody. And see you next week. I'm not sure exactly what day, but I will see you next week. And hope you have a happy Thanksgiving or celebrate in some way by eating a really big turkey, unless you're vegetarian. Thank you, everybody, and have a great weekend. Bye-bye.